Hello, my name is Victor Hengjun Hung and this is the video presentation for the subject KIB1014 Human Musculoskeletal System from Group 3. In this video presentation, me and my teammates will explain the biomechanics analysis done in many real-life scenarios experienced by a digital nomad, as well as the prolonged effect of loading on the joints and bones. And the scenarios that our group chooses are as follows: sitting while using a laptop for an online meeting, walking while using a phone, and sitting while using a phone. In the following slides, I'll first explain the biomechanics of the spine and upper limbs in the aforementioned scenarios. In every scenario like this, several assumptions had to be made before the full analysis. Scenario 1 is a person sitting and using a laptop for an online meeting. First off, the full body shot of the person is like this. His legs are under the table and in front of the chair legs. His torso is upright and leaning slightly on the backrest of the chair. His arm is in front of him, elbow and wrists resting on top of the table and parallel to each other. His head is bent slightly downward, so that his point of view allows him to perfectly see the laptop screen. The person's spine is in a position where it will be the most comfortable. The posture allows him to maintain the spine natural curve, while evenly distributing most of the body weight through the pelvis and the chair. Due to the person sitting on a chair, there are compressive force acting on the spine from the body weight, and shear force on the lumbar spine from the head leaning forward. Speaking of which, the man's head is bent slightly downward, which would cause an increased moment acting on the neck. For the biomechanic analysis of the upper limb, since the forearm is placed on the table, it significantly reduces the amount of torque acting on the shoulder. The elbow acts as a stabilizing joint in which the person used to further decrease the compressive force acting on his upper body, since most of the arm weight is distributed to the table. The wrist is also resting on the table. It reduces the stress on the carpal region as opposed to constantly hovering over the keyboard when typing. In this second scenario, the person is walking normally. His left arm is swinging as a person normally would when walking. His other arm is holding his phone in front of his torso. His head looks slightly downward to look at the phone screen. This causes cervical spine to flex as the head center of mass is shifted forward, creating an increased moment acting on the neck. With the hand holding the phone, this causes slight thoracic flexion as the body's center of mass is slightly shifted anteriorly. The pelvis rotates in a cycle in tandem with the walking motion, while the lumbar spine stabilizes the balancing of the body. For the upper limb analysis for scenario 2, in this scenario, one of his arms is swinging back and forth, while the other remains stationary because it is holding the phone. This causes the overall balance of the person to be lopsided and the gait mechanics to become asymmetrical, which means the pelvic has to be adjusted to provide more stabilization through the increased rotation. The elbow also experiences constant joint force that can cause fatigue if held for a long time. In this third scenario, the person is sitting on the chair while using a smartphone. His upper body hunched forward and his hand is holding the phone in front of his face. His elbow is resting on his thigh to prop up his forearm. His head is cranked upward to have a better view of the screen. For the biomechanic analysis of scenario 3, the lumbar spine goes into flexion, tilting the upper body forward with increased compressive force in the intervertebral disc and tensile loading on posterior spinal ligaments. Despite the center of mass shifted anteriorly, the elbow rested on the thigh is able to partially support the heavy weight of the body. The thoracic spine is heavily flexed. It stretched the posterior ligament and caused a heavy hunchback. Cervical spine extends, causing high compressive loading in the posterior cervical joints, so that the head can bend upward to allow the person to be on eye level of the phone screen.
Lower limb analysis is not as complex as upper limb analysis. Number of articulation is limited to two at the hip joint and the knee joint. Lower limb is passively receiving body load, save for repositioning once in a while. When sitting, body weight of the upper body acts as a force through the spine until the sitting bones and the hip joint. Most of the muscles are largely inactive. The hip flexors, which connects the lower back and the pelvis to the thigh bones, are shortened while the gluteal group is elongated. Even though they are shortened and elongated, they are not active. Majority of the force thus acted on the bone and the hip joints. In a normal sitting posture, hips and knees are flexed at approximately 90 degrees, while the ankles are in a neutral position with the feet flat on the floor. At the hip joint, the body weight is transferred to the pelvis onto the chair. The gluteal muscles and hip stabilizers help maintain pelvic alignment and prevent excessive tilting. At the knee joint, the quadricep muscles maintain slight tension to stabilize the lower leg position. The hamstrings are shortened due to the knee flexion. At the ankle joint, the feet provide a stable base for support. Minimal muscular activity is required when both feet are evenly placed on the ground. The center of gravity in sitting is lower compared to standing, which increases stability and reduces energy needed to maintain posture. However, poor sitting posture can create biomechanical problems. For example, crossing the legs or slouching may cause uneven weight distribution, increased pressure on the knees and hips, and muscle imbalance over time. Prolonged sitting may also reduce blood circulation in the lower limbs and contribute to joint stiffness. When standing, as using the standing workstation, load will be acted on the hip, knee, ankle, forming sort of a support chain, transferring the force to the ground. As opposed to sitting, muscles when standing are activated to support the bone and ensure load transfer to the ground stays vertical. Second difference, when standing, the hip joint and the knee joint are substantially under stress as the force from the muscles are exerted to keep an upright position. In an ideal standing posture, the hips and knees are fully extended, while the ankles remain in a neutral position. Body weight is distributed evenly between both legs. At the hip joint, the gluteal medius and other stabilizing muscles help maintain pelvic balance and prevent the pelvis from dropping to one side. At the knee joint, the quadriceps maintain extension and stability. The ligaments around the knee are also contribute to support with minimal muscular effort. At the ankle joint, small continuous adjustment occur to maintain balance. The gastrocnemius and soleus muscles help control body sway and keep the body upright. The center of gravity is positioned higher in standing compared to sitting, making balance more challenging. Because of this, the muscles of the lower limb must remain active continuously to maintain posture. If standing posture is poor, such as locking the knee or shifting weight to one side, it may increase stress to the joints and lead to fatigue, pain, or postural problems.
Here I'll explain about the effect of long-term loading based on the analysis on bones mentioned before. The main loading experienced by the spine are compressive loading on the entire spine as a whole, shear force in the lumbar spine when the person is bending forward, and static postural stress when the person is holding the same posture for a long time. Loading like this can cause long-term effects such as spinal degeneration, bone remodeling due to chronic stress, and reduced neutral alignment that can affect the overall balance of the body. In most of the above scenario, the cervical spine is flexed for a long time, which can cause what is commonly referred to as text neck. When it comes to the joints, it is more specific, as there are many joints in the human spine and upper limbs. Let's start with the spinal joints. As the joints that connects all the vertebral discs together, when under prolonged excessive loading, it can increase the deformation of the disc and also cause it to reduce hydration, which makes it so that it decreases the ability to absorb shock. The shoulder joints can experience increased joint compression and altered shoulders mechanic. They can temporarily reduce rotation. The elbow joints will increase overall stiffness and cause local pressure discomfort, making some movement awkward and painful. Finally, the wrist joint will experience overall joint fatigue and increased carpal tunnel pressure, which then will cause what is known as a carpal tunnel syndrome. Since the wrist joint is one of the most used part of the upper limb in day-to-day life, this effect will cause a person to lose overall work efficiency.
Compressive loading occurs when body weight pushes downward to the bones and the joints of the lower limbs. This force mainly affects structures such as the hips, knees, ankles, and the vertebral column. While normal compression helps maintain bone strength, prolonged loading can gradually wear down the joint cartilage and increase stress on the spine. The shear force occurs when one surfaces move parallel against another surface. In the lower limb, shear forces commonly affect the knee and ankle joints during prolonged standing or poor posture. Continuous shear stress may strain ligaments, cartilage, and surrounding soft tissues. This can increase the risk of instability and joint degeneration. Another important factor is the static postural stress. When a person maintains the same posture for a long period of time, the muscles and the joints remain under constant tension. The blood circulation may decrease, causing muscle fatigue and discomfort in lower limbs. Another effect is body remodeling due to the chronic stress. The prolonged loading can cause the joint and the bones to grow unevenly. Bones naturally adapt to repeated loading by changing their structures as well as the joints. Prolonged loading can cause this growth to be uneven and disrupt the neutral alignment. When the neutral alignments are disturbed, it can exacerbate and cascade down to further postural injury.
Okay, thank you so much, Qingshun, and thanks for the great breakdown of the chronic bone and joint problems digital nomads face. As biomedical engineers, we don't just point out what's wrong, we build solutions that fix the actual biomechanical root cause we just talked about. And I'm Liu Renxi. I'm going to show you some solutions I think for these three common issues, and I will also give some examples, try to explain it clearly. First, let's tackle the most demanding condition, test neck. We learned that a 16-degree head lift puts 27 kilograms of load on the sternal spine, equivalent to carrying an 8-year-old child all day. So the best way to fix is to let the patient correct their posture by themselves. A lightweight device that tracks the posture anytime it reminds would work perfectly. To letting users fix their posture on their own. For example, the Upright GO2, a smart posture trainer. This tiny 15 grams pebble-like sensor attached to your upper back using a silicone necklace. It uses dual gyroscope sensors to detect even minor slouching and delivers gentle vibration feedback in real time. Then finally train your muscles memory to maintain neutral spine position automatically. This method lets patients correct their posture on their own, and it tackles the root cause of the problem and has almost no side effects. Next, carpal tunnel syndrome. The root cause is keeping incorrect posture for a long time when typing or using a mouse. Your waist is almost always burned up, down, or sideways, not straight. It cuts the already narrow carpal tunnel and puts constant pressure on the middle nerve. The first solution that comes into mind is using external device like gloves to keep the user's waist in a healthy position for a long period of time. The idea is to add properly shaped rigid components inside the glove. These hard inserts are designed to hold your waist in the neutral, straight position, the position that keeps the carpal tunnel widest and put the least pressure on the middle nerve. They prevent you from bending your waist up, down, or sideways while typing or using a mouse, which is exactly what caused most computer-related CTS in the first place. For patients who already have the symptoms, we can design a hand-shaped device that delivers target pain relief treatments like heat therapy to specific areas of their hands. This helps relieve pain and dilate blood vessels. About the early onset king osteoarthritis, the condition is often caused by improper sitting posture. Besides correcting the patient's sitting posture, a more appropriate approach is to use additional equipment to reduce daily wear and tear on the corresponding joints. We can choose to design a suitable king frames to reduce the pressure on your joints in daily life, helping to alleviate symptoms. Finally, the fundamental goal of biomedical engineering is to adapt device to the human body, providing targeted treatment for common symptoms in society. The digital nomad lifestyle doesn't have to come at the cost of your health. With these proven engineering innovations, they can work smarter, protect their bodies, and enjoy the freedom of remote work. That's all. Thank you.